Anti-kakusog pa rin po. Hindi po yung anti-kakusog ito pag-explain ha. Chemo naman tayo, chemo. Chemo. This time, we are not after pressures. I mean, meaning to say the receptors are stimulated not by change in pressure. Kasi sa baroreceptor reflex na stimulate yung receptors by change in pressure, either an increase or decrease in pressure. This time, change in chemicals. Anong chemicals? Ayan po, mga kapatid. So, the chemoreceptors are still located in the carotid and aortic bodies. They are stimulated if there is a decrease in oxygen, a high carbon dioxide, or increase in H+. So, the net effect will be sympathetic activity only, and then it will cause arterioles and veins to vasoconstrict, increasing blood flow or pressure. Walang effect sa parasympathetic. Okay ba tayo nun? Pwede bang ulitin ko nun, Dok? Ano yung pareho pa kasi ng sinking? So, a decrease in oxygen, an increase in carbon dioxide, an increase in H+. What do you think is happening to the patient pag ganun? Mababa ang blood flow, something, or hypoxemia siya. Pwedeng hindi mababa ang blood flow, pwedeng anemic. Pwede din namang nagre-respiratory depression yung pasyente. Diba? Darna, feeling, powerful, lino, pero pagpatay niya ang pasyente, taklapan niya yung ulunan nila. Nakakreate niya dako-dako ang spak, ipabuto niya mga bongga. Pero pagpatay na po, takpan na din yung ulunan ko. So, asphyxia, no? Di makakaginhawa. The oxygen level will decline. So, kung di nakakaginhawa, di rin nakakapasok ang oxygen through the airway. Di rin liwat nakakagawas ang carbon dioxide. Parang tanga lang, no? Wala makasunod ng oxygen, pero nakagawas ang carbon dioxide. Di ginawas. So, hindi. The carbon dioxide will increase. Therefore, the H+ will also increase. Kaya papakian kung kailan nag-increase ang H+, kaya kukurekiran na vessel packaging lang, niya. Hindi ko na kaya. Anyway, so, carbonic acid killing me. Diyos ko na yun. So, the net effect will be an increase in sympathetic activity para somehow ma-increase man lang ang blood pressure. Okay? Wala na si Batman. So, this time, these chemoreceptors are stimulated if the blood pressure is below 80. Kung mga baby, mga 90 la, sugad ako bayad, takot bayad, baby, labi ng kumpiraw ako, mga 90 over 50. Nakakalaman naman kung si chemo or stimulated, no? 90 pa lang. Yes, ma'am, may question ka. Alright. Wala? Okay lang. Don't be shy to ask question. So, chemo, anong BP siya na-stimulate? Paano kung 80? Hindi pa po yun nun, no? Pero technically kasi sabi niya less than, no? Nasa libro kasi. Grabe naman, hey, Doc, 80 talaga ang naging pang-trick question na lang. Iyan nyo na, basta less than 80. So, there is a decreased blood flow in the carotid bodies. Pag bumaba yung pressure, then therefore, the oxygen concentration and the cardiac output delivery magkakaroon ng change. So, there will be an increase in excitatory signals in the vasomotor center, stimulating the sympathetic activity, and then vasoconstricting the vessels, and then it will increase the total peripheral resistance, therefore, increase in arterial blood pressure. Dok, walang effect siya sa heart rate at saka contractility. Chemo. Meron ba? Ikaw po yan. Meron wala? Kaya waray daman? Kaya sympathetic ba na niya mga so parang pilila kung sympathetic. Meron. Sample lang dyan. Meron din yan. Okay tayo? Lord have mercy on us. So, this is another receptor. This time, low pressure naman sila. When we say low pressure, because these receptors are located in a situation or in a chamber na mababa pressure doon. So, any change of low pressure there, may stimulate sila. So, they are the atrial and pulmonary artery reflex. So, if the atrial reflex that activates the kidneys, the volume reflex through increase of atrial natriuretic peptides and decrease in antidiuretic hormones. So, yung atrial reflex, yan yung tinatawag na vein bridge reflex. There will be, if there's an increase in volume, it will stretch the sinus node, then there will be activity of the sympathetic and vagus nerve to increase the heart rate. Pero meron pa siyang effect in increasing diuresis. Kasi increase yung volume. So you will release natriuretic peptides. When we say natriuretic peptides, these are your endogenous diuretic. Nag-gets nyo ba yun? Ano nyo mo siya, sarili mo siyang endogenous, meaning you produce it in your body. Hindi katulad ng exogenous diuretic, furosemide. Okay ba tayo doon? So, ang mga matatalinong mga mahadera, kaya mo kita nag-iinatag yung furosemide na pampaihi kung nag-volume overload it pasyente like edematous, no? Furosemide at ininatag, what if we increase the natriuretic peptides? Therefore, we increase the natural diuresis. So, nag-discover nila, pampa-increase in effect. Ang problema dahil, pag na-stretch yung right and left atrium, increased volume, no? Ibig sabihin, edematous na yung pasyente, increased volume, na-release kayo natriuretic peptides. Pag natuniyak kidney, mayroon tinatawag na neprilysin, chismis lang yun. Meron dito neprilysin, tapos diretso lang niya, mga 5 minutes lang, inhibit na niya agad yung natriuretic peptide. So, umihit na naman ng gis sila. Kaya na-inhibit tayo ng neprilysin. So, kahit mag-inject ka pala ng natriuretic peptides, wala ding effect kasi nandun si neprilysin nakaabang sa, gawa tayo ng neprilysin inhibitor. Inhibit natin itong natridor. Wala kayo ang effect. Nag-increase yung activity ng natriuretic peptides. You don't need to inject pala natriuretic peptides. You just need to give neprilysin inhibitor and yung natural natriuretic peptide, iihig na siya. So, increasing volume in the atrium, release of natriuretic peptides, if you inhibit neprilysin, iihig ang pasyente. Endogenous, natural siya na pampahig. The effect was good. Better than injecting furosemide. Bakit? Ganun din naman, pinaihi mo. Furosemide, inject mo, pinaihi mo. Pero yung isa, pinaihi mo, but ibang process siya. You have increased the activity of your endogenous diuretic. Bakit kaya mas magandang effect?
Readily available.
Readily available?
Uh,
Because natural siya. Charot. Yun yung findings niya. Kaya there is a revolutionary drug in heart failure, yung neprilysin inhibitor. No? So lumabas lang siya mga 2005, no? Hindi nyo alam yun, no? So, ganon ang drama. So, yan yung atrial reflex control in the heart rate. If there is an increase in volume in the right atrium, then you will stretch the atrial receptors. The effect will be increased in sympathetic activity to somehow decrease the volume, increase the heart rate, increase the contraction. So, in vein bridge reflex, ang effect lang talaga is increase heart rate but not directly decreasing the volume. Iba yun. Ang pag-decrease ng volume is stimulation or increased production of natriuretic peptide. Technically, if you talk about vein bridge reflex, if you increase blood volume, there is an increase in heart rate. Okay ba tayo doon? So, na-found out nila yon, yung nag-increase, nag-i-inject ka yung increase in volume, fast drip ka, the heart rate might increase. And that's because of vein bridge reflex. Okay ba tayo doon? Wala na 5 minutes lang kasi ang span of. So dapat matapos in 15 minutes. Okay, CNS. Among all the reflex, ilan na bang pinag-usapan natin? Baro, chemo, atrial, o ano? Yung CNS reflex ang pinaka-powerful of them all. Siya talaga ang pinakabonggang-bongga. Pag ma-stimulate mo ang ischemic response, reflex, talagang ang blood pressure pwedeng umabot hanggang 200 million. 200 millimeters mercury. So, mga 1970s, 1980s, stroke patient, nag-cerebral ischemia. What will be the effect of the blood pressure? Increase, decrease?
Decrease.
Increase. Sinus reflex, there will be increase in sympathetic activity. There will be discharge. Lahat ng discharge, talagang itotono niya sympathetic. There will be an increase in blood pressure. It will be the most powerful reflex to increase the blood pressure of all the reflex na pinag-uusapan natin. CNS ischemic reflex. So, pag nag-cerebral ischemia ang pasyente, tataas ang blood pressure. So, mga 1970s, 1980s, ang management up to 2000, ang management pag nag-i-stroke ang pasyente, cerebral ischemia, dadating sila, matataas ang blood pressure, ipapababa namin ang blood pressure sa emergency room and then sa ward. Mataas ang mortality. So, meron namang neurologist na teacher siya ng physiology. Bakit parang sa lecture namin CNS ischemic response, na-stimulate yung sympathetic, it's just a reflex to increase the BP. Bakit natin ilalabanan yung mataas na BP? What if I conduct a study? So nag-study siya. Lahat ng mga stroke patient na matataas ang BP, hinayaan lang niya. Hinabayaan niya. 160 to 200. Cut-off niya 200. Pag more than 200, saka lang niya mahatag in medicine. Pinapabayaan niya. Daw, kaniya findings, bongga. Ibubunggayan nga tanan. Very robust. Increased yung survival ng mga stroke patients niya. Compared sa mga stroke patient, hindi pinahabubo ang BP. So, nag-present si mga dirang teacher sa National, International, Universal Convention. Gulantang ang mga doktor. Change of guidelines. Starting now, all stroke patient arriving at the emergency room, acute stroke, if the blood pressure is 160 to 180 to 200, walang gagalaw. 200 lang tayo gagalaw. Diba? Nobel Prize winner si Adele. Ganun lang pala yun, no? Sana meron man lang sa inyo mga ganyan. Study lang ka mo, bisa lang dito kita, arong, dito lang, kulugo, makalistapo ka mo. How to manage kulugo, diri yan, kidlat tayo, kidlat. Ganon. Or ato ka makakis-kisit kabulanan. Ganon, no? Sana may daman lang makadiscover and ganyan. So, the net effect will be an increase in total peripheral resistance. There will be all the blood volume will be retained to maintain the blood volume. So it will be the last stage. It will be the most powerful activators of sympathetic effect. So, however, na-stimulate lang siya if the blood pressure is down below 60. Which is also at the same time, that blood pressure below 60 will cause cerebral ischemia. Okay ba tayo doon? Hello? Sino ang less than 80?
Chemo.
Oh. Ano iba, wala na papamemorize mo, maglaway na titikon na muna. Photoblahan first slide. So, si CNS ischemic reflex, anong BP siya na-stimulate?
60.
Because that is the time, if the blood pressure is below 60, that is the time that there will be CNS ischemia. So, there will be brain ischemia. So, the CNS ischemic response will be stimulated to increase blood flow somehow para man lang mabuhi it pasyente. Kahit na siya, na-survive siya, pero kahit paralyzed siya, pero at least, comatose lang hindi ha. So, dalawa yan. Meron tayong Cushing reaction. So, they studied, alam ba, bakit ba pag nag-cerebral ischemia, tumataas ang blood pressure. So, it's because of, one, if you have cerebral ischemia, there will be an increase in intracranial pressure because of compression of cerebral blood vessels. And then, it will lead to cerebral ischemia and increase cerebral PCO2. Then the vasomotor center will have an increase in sympathetic activity. It will cause a profound increase in arterial pressure. So, dito sa Cushing reaction, this is more of an increase in intracranial pressure, causing cerebral ischemia, increasing sympathetic activity, increasing blood pressure. Yung isa is, ayun lang pala, Cushing. Ah! Ah! Cushing lang. So, abdominal compression reflex. Hi, mayroon talaga akong patient ngayon, nagbabawal ischemia siya. Ang taas ng blood pressure. Refer ng refer. 170, 160 ang BP. Anong gagawin ko? Di ba kayaan lang? Eh paano yan? Yung doktor, ang tawag mo, taas ko ng BP. Ito nagsicerebral ischemia, bowel ischemia. So any ischemia, bowel ischemia will also stimulate the the abdominal compression reflex, stimulating sympathetic activity, increasing blood pressure. So tandaan nyo yan, yung mga pasyenteng nagbabawal ischemia, tumataas talaga ang BP. Naturally, the blood pressure will increase as a compensatory mechanism. You will not do anything about it. You manage the ischemia. Operahin. Release the ischemia. Pababa din yan. Kaya ganyan yan, napipilitan naman doktor, magpipila ni cardiac trip, mababang BP. Pag anesthesiology, no? Pag-inject, pag-anes, di ba, stop mo ang sympathetic tone, drop down ang BP, hala, pasaka na naman, norepinephrine naman yung dopamine, sige, bahala ka mo, parang nicardipine, kaya ayaw kong galawin siya, kasi compensatory mechanism lang siya. So, CNS response, CNS ischemic reflex and abdominal ischemic reflex, both will increase sympathetic activity. So, that's the end of it. Let's summarize lang, baroreceptor reflex. We are more of pressure. If there is an increase in pressure, what happens to the effect? Increase in sympathetic or parasympathetic tayo? Para. So, bababa ang blood pressure. On the opposite side, if the blood pressure decline, the baroreceptor will have an effect, but this time it will be more of sympathetic, increasing the blood pressure. Ganun din si chemo reflex, but it is more of decreasing oxygen, increasing carbon dioxide or H+. It will stimulate the sympathetic activity, increasing the blood pressure. So, meron pang ibang example, yung atrial reflex, meron pang CNS, which is the most powerful. Among all these reflexes, CNS ang pinaka-most powerful. Pwede niyang may pataas ang BP up to 200 to 200 plus. Tapos, but, na-stimulate lang siya if the blood pressure is less than 60 or if there is cerebral ischemia. Okay ba tayo doon? Yes.
Mataas ang yung blood pressure para ang blood
Yes, maka-flow. Agree. For example, stroke. What give you type of example of stroke? Nabara, thrombotic, di ba? So, decrease ang flow, obstructed ang flow in the cerebral artery. So, the area supplied by that artery will be ischemic. So, there will be brain ischemia, no? Tapos, you want to increase the blood pressure para kunwari makasulod man nila to increase pressure, increase velocity, to increase perfusion. Kasi itong ischemic penumbra, di rin man itong ischemic, ito nga area, pwede may dapat dito area ng ischemic, the side is also ischemic, but actually kaya pa nilang mabuhay. Nagigets niyo? So you somehow increase the blood flow, baka hindi sobrang malaki yung ischemia. Yung mga sides nun, baka hindi pa naman siya. No? Good question. Any question? Anong oras na?
11:30.
Gutom na. Yes.
Is it possible na normal ID?
A person has high normal BP. No. They might have baseline high BP, but it doesn't mean that we will not manage, we will not work out. Our cutoff is less than 140. So if your blood pressure is 150, we will not call it normal. It might be for you feel okay, but we will not settle for 150. We need to bring it down to 140. Our cutoff is 140. So it has been studied, kahit ang pasyente 160 ang blood pressure, pero walang cause, walang nakikita. Wala talagang ma-find out, kidneys okay, brain okay, heart okay, pati yung pagmumukha ng pasyente okay din. Okay lang talaga siya, pero 160 ang BP niya, mahayaan natin. So, studies have shown mga ganyan pasyente, mataas ang mortality. Eventually, they will have cardiovascular, stroke, heart attack, renal problem, meron silang mga nephropathy, retinopathy, neuropathy. So eventually, give it mga 5 to 10 years, up to 20 years. So hindi na natin sila hinahayaan. And we now label them as essential hypertension ang cause. Meaning, hindi talaga namin mahanap ang cause, kaya essential na lang. No? So 140 and cut off. All over the world. Did I answer your question? Okay, tayo na. Yes? Hindi pwede ma-lower. What do you mean? 110 na takbito, ilo-lower mo pa? So 160 siya and you want it low. Yes, that's the goal. We want to lower the baseline BP. Kasi imagine mo, 160 ako na parang 160, okay man, galing ko na ako, ibibihan ako 160. Yes ma'am, okay kayo na 160. Pero pag magtrabaho ang pasyente, maaaring hiya, magutom hiya, may nang makita mo mga nagkapagurumok. Di pa kaya natin mo 160. Okay lang kung 170. What if 200? More than 200? So what will happen to the vessels? Endothelial damage. What will follow next to endothelial damage? Atherosclerosis or inflammatory process. So that's why eventually they will have cerebrovascular disease. Okay? So we lower the baseline blood pressure. If the baseline blood pressure is considered hypertensive, more than 140. Ooh, good question. So there are medications to lower that, which is not part of the lecture. Yes, sir.
Ang procedure daw, pagkuha ng thrombus, ako pala,
Pagkuhan thrombus, if you mean in the coronary arteries, yun yung angioplasty. But kung ang example naman natin doon sa brain, meron din doon, ano bang term? Cerebral angiogram and I forgot the term. Percutaneous something removal of the thrombus. Naglalagay din sila ng stent doon sa brain. Nagugulan akong pagsagot if I need to answer that technically. Because in angioplasty, if there's a thrombus in the artery, coronary artery, merong thrombus sa angioplasty, hindi naman talaga tinatanggal ang thrombus. Hindi rin man niya ngaging, dukwa punta, tapos dukwa, pagawa. Hindi naman talaga siya tinatanggal. You just balloon it. And then, expanded na siya, and then you put a stent. Wala naman talaga tinanggal doon. But, let's say, meron ding procedure that acute yung thrombus, they try to remove the thrombus or they try to make tunaw the thrombus, they inject quaternalytic intracoronary to make tunaw the thrombus. So, percutaneous coronary intervention. Pwede yun. Kaya, nag-stop muna ako if I need to answer technically or just plainly say yes. Any question? Wala, di rin na natin kaya sa paka-chapter. Kaya nyo pa? Sige, fine, ayaw mo, di ba? So next time ulit yung next chapter. Maganda pa naman yung blood pressure pa naman sana yun. So sunod na lang. Questions? Dapat yung mga question nyo sa next chapter yun. Kasi yun is chronic na control of blood pressure. Long term. No, rin natin. Yes? Ano difference in thrombosis versus terus ko ito. Siguro if you are really interested about that, when we say thrombosis, there is endothelial damage. So, Virtue's triad, so stasis, endothelial damage, and hypercoagulability. So it will stimulate, pag yung endothelium kasi na damage nyo, meron pa mga bone Willebrand chem, meron pa mga something na marirelease which should be exposed. And then there will be anti-inflammatory reaction. It will stimulate the platelet. So the platelet will try to adhere. Then pag adherehan mo sa platelet, it will try to, mga kapatid, may nagdudurugan na sa atin eh. So, platelet activation, na-activate naman ang mga classmates back, nag-aggregate sila naman. So platelet aggregation follows. Then after that, there will be stimulation of all the factors. Diyos ko Lord, ang hirap nun, factor K. May cascade. Magka-cascade siya. So yung mga medtech dyan, tulungan niyo ako. So depende yan kung intrinsic, extrinsic. And in the end, there will be production of thrombus. And at the end, that thrombus will be cemented. Fibrin yun. So yun yung thrombus. Now, going back to the other side, atherosclerosis. Atherosclerosis. Endothelial damage. Nakuho. Endothelium. Mayroong bad cholesterol, LDL. Pumasok doon sa endothelium. Tunica media na ang tridor. Dapat, anong mangyayari pag nasa tunica media? It's a foreign body there. So there will be inflammatory reaction. Pag inflammatory, i-engulf yung macrophage. Magiging foam cell siya. Yung chemoattractant, yung mga muscles doon sa tunica media, makatupahan tunica intima. Tapos magdadamo pa nila. So, magtitikalubo na, magtitikalubo. So, the lumen will now be. Now, take note, they are inside the intima, not outside. When I was a student, my teacher did not explain to me. I thought that atherosclerosis is on top of the intima. Na nagbubundok lang yan. Ito ay na-tridor hasulod. So if you do an angiogram, mura ka ay makikita. Ano yung nakikita? Kipotlaan. Ito ay hasulod. Until maburit. Kaburit, an atheromatous plaque with a thin fibrous cup and high LDL. Lumalabas yan sa exam. Not ang exam nyo, but exam namin in cardiology. So pag ma-rupture na yon, then it will now stimulate the cascade of thrombus fibrin. Yes, sir.
Tapos yung embolism, Doc, general term yun.
Now, if you talk about embolism, it's any thrombus formation that has been thrown away, no? Thrown downstream. Or upstream, pwede. Downstream na lang. So nag-travel siya, hindi siya nakabara on that area, but nakabara siya somewhere. Yes, ma'am. I like question. Ano daw? So kung pinsaksak, hayaan lang natin yung pasyente na meron na siyang compensatory, no, na mataas ang BP. So hayaan na lang natin siya. Sige, sir! Paniguruhan niyo yung compensatory mechanism.
Stop bleeding.
Itaas mo yung blood pressure, hayaan lang natin siya. Of
Stop
course,
bleeding.
hayaan natin yung mataas na BP. But we need to do something.
Stop bleeding.
We need to do something.
Stop
We
the
need to
bleeding.
stop the bleeding. Initially, we have to hydrate. Maybe we can give some vasoconstrictor, vasodilator. But we need to treat the main cause.
Bulubin.
Did I answer your question? Yan yung nangyari nang gimponohiya, siguro hafil, nataas itong BP. By the time mag-idara emergency room, baksak ng BP. Kasi you did not do anything. Wala kang ginawa to stop the bleeding. So initially, we transfuse blood, we drip with volume, while preparing for surgery. Oh, I like the question. Pero huwag naman natin hayaan. I mean, I get your point. We can make hayaan natin yung compensatory mechanism, but that compensatory mechanism, take note, that baroreceptor, acute chronic.
Cute.
Okay? Acute. So, when we say acute, pang ano lang siya.
Temporary.
Pang mabilis ba? Yes, ang bilis
Temporary.
ng effect niya. Pero hindi siya pang matagalan, parang jowa lang.
Diribotolite.
Ang bilis ng pangyayari.
Diribotolite.
Ang bilis lang. Yes, ma'am. Hindi ko alam. Hindi ko alam kung how long. Hindi ko alam. Time out lang. Pag may pasyente akong ibuno. Ano, sir? Ay, ano pag-lebuti? Timingan ta. In the book, they say it can last for a few hours. So it did not stay 1 hour, 12. Few hours lang yan. Kasi ang hirap kasi alam mo, physiology, in terms of nasa libro, that's in the book. But if you go to a patient, iba-iba ang pasyente, bawat tao magkaiba-iba ang effect. Pwedeng 1 hour lang sa kanya, ang baroreceptor, whereas sa isang taong maburuhay talaga. Minsan nga, di ba? Fernando po, pinagpapatawa sa mga tinae. Sige na, the next
Cardo.
day, pahirap yung punahan. Pero sige pa, sikat-sikat pa.
Cardo.
So, depende yan, but in the book, it just says few hours. Now, kung ilang hours, I cannot say, I cannot comment.